Hi, welcome to episode 2 of BraveTalk. I'm Dr. Melissa Giglio.
And I'm Daisy Geddes, and we're so excited to be back for another episode, episode 2. How are we feeling, Melissa?
Good. Still a little getting used to being on the microphone and some technical issues and figuring this out.
It's all a learning curve.
It is, but a very exciting new venture to be going on to bring our real life clinical situations into the audience and to be able to problem solve.
Agree. And we've had so many interesting things come up this week just from our clinical practice in terms of the kids that we've interacted with and the problems that we've solved. And we thought it would be really helpful actually to kind of just sit down and go through some real life clinic stuff.
I think that's really useful just because these are things that we are facing consistently. And it's good for us to kind of walk people through what the situations are, how we would address them, and just kind of really just share our thoughts about how we would support these kids and these families and have some celebrations too.
Exactly. There were some celebrations on the horizon for us this week. Some kids doing really well, which is always so rewarding after so many hours of not only our hard work, but their hard work, really, and us just kind of being the gentle hand behind them, giving them the nudge that they need. So that's been really exciting this week. And I know that you've had some challenging situations come up in the clinic as well this week with
Yep.
kids kind of going through some changes, and maybe we start there because the changes thing is such a, it happens to all of us, and we're always fluctuating in terms of our plans, in terms of things that come up, in terms of people that are around. Maybe you can share a little bit about what happened this week that contextualizes this for us.
I think that's a great place to start. So I have been supporting this family for a while. They have two young kids. I just started kind of working with the younger one who is beginning to show some very early signs of selective mutism. He's a toddler, he's little, but knowing the family very well and knowing the older sibling who has lots of language, um, they just started to notice that he was not speaking as much just in general, but also not speaking in certain situations and already using some nonverbal communication, and nodding and, high-fiving as a means to communicate at, two and a half. So really interesting to see that pattern in the family. That's emerging. The older one is doing great, I think I should add. And, we actually discharged him and see him occasionally for some little boosts now and then because practice still needs to be happening. And, sometimes we see some of those old behaviors reemerge when they're not practicing. But the little one is kind of the focus of today.
Could I just jump in and ask you a question here? Because this is
Sure.
actually a really interesting thing that maybe some people haven't considered or don't know. You're talking about two kids in the same family.
Mhm.
How common has it been in your kind of clinical practice to see this in siblings or kind of run in the family, so to speak?
So that's a really good question. So with families, we do see that anxiety obviously runs through families. However, it isn't always presented in the same way. We have seen a handful of siblings. Sometimes they're twins. Sometimes the younger one will come in first, and then we hear about the older one. Sometimes vice versa. We've definitely had a family of three come in before. So we never know. I would say more times than not, we don't have siblings,
Hmm.
but we've had our fair share just even since we've been working together. And it really just depends how early we really treat the first identified patient and how the habits really change within the family.
Hmm.
Sometimes when we start to incorporate skills and really train the parents and any other caregiver, they can actually be changing and addressing that behavior in the home without ever coming in. Sometimes that's not possible. So I think it really just depends on the family. It depends on the presentation.
It's so interesting though, isn't it, how it can come up with kind of two different kids in the family like that. And you also spoke to something so true, which is that parent training piece and the fact that, we see these kids for maybe like an hour a week, 2 hours if we're really lucky, but the parents are the main caregivers that are with them all the time. So we can push them for that hour, but actually upskilling parents is so important in what we do. It's such a crucial piece of the puzzle.
I think that's actually why the initial approach to treatment for SM and social anxiety kind of has pivoted a bit from just working with the, identified patient, the kid who has the issue. And it's really focused, I'd say, in the past few years, decade, dare I say, that we're really focusing on the caregivers. And the reason for that is they're with their kids all the time. So to truly have an impactful change that's long lasting, it makes sense
Yeah.
to teach them the skill, to help them feel empowered so that practice can be happening more consistently.
Yeah, and I think that we're consistent as well, like across different environments. And that's also why we really also love to train teachers as well, so that we can have that consistency across all those different environments. So the messaging is the same, but also that kind of gentle pushing and nudging is there across all of those different environments so we can make the most impact possible, right?
Yeah. Definitely. I think as much as we can change the entire system in terms of the school, the family, and the community to really support the child, the faster the change may happen and the more robust the treatment can be, which is what we all want. Again, how these kids behave at home in their safe environment is very different than how they interact with the rest of the world. And our goal is to have them as comfortable and as confident as they are at home out in the world.
Yeah. Yeah, so true. Okay, sorry, I interrupted you. We went on a bit of a tangent, which isn't unusual for us. Okay,
Not at all.
back to the change, so the situational change that this family was kind of going through.
Yeah.
So I think we were around, so
So
the younger brothers come in.
he's come in, and then it was disclosed to me today that the primary caregiver, not the parent, but the primary other caregiver who lives in the home, kind of the nanny, will be leaving soon. And she's been with the kids almost their entire lives. And just it really made me think about how are we preparing this child for this in a way that they can understand, because this can feel like a massive loss. This is someone they see 6 days a week. They spend a lot of time with them. Both parents work. It's very much feels like a member of the family who is there providing for them and giving that love and support. That's who brings him to session. And she's having trouble with the idea of leaving, going to another family, going back to the Philippines. And he doesn't even know yet. And we're just starting our work together. And to remove someone who's a big part of this puzzle in terms of his development and support. I brought her into session so we could start kind of encouraging her to use the skills, really focusing on full sentences, even getting some more information from her. And it just, preparing for changes is really important. Helping, if possible, to have caregivers overlap. So there's almost a handover is really helpful. I'm not sure how much emphasis is put on preparation for change sometimes so that it feels less substantial or less traumatic even. And I think that's an important thing to note. And it's not that we're saying change is bad. In fact, I think you and I are big proponents and advocates for change and
Yeah.
the benefits of it. However, with preparation, and when you're little and you're at these, you're developing really rapidly and you have some difficulties, I think there needs to be some care with how these changes are handled. And you don't want too much too soon, as it can just feel overwhelming. And for parents to be aware of what behaviors may emerge from this sort of change. We might see a really difficult time coming through for the child. We might see some regression. We might see some more outbursts and tantrums and dysregulation, maybe even some increased clinginess
Hmm.
to the caregivers, just due to a lack of understanding. I mean, these are toddlers we're talking about here.
Yeah, and I think especially with when we're talking about in the context of anxious kids as well, changes can be difficult for anyone is but when you're anxious and it's a kind of primary caregiver role that's changing, that's kind of a whole new level of change. And how do we prepare our anxious kids for that? And again, to what you were saying, we are big proponents of go out there, try something new, put yourself in uncomfortable positions, um, and kind of change things up a little bit. But again, I think what you're saying is there's kind of we want to prepare them. And I think this is also a delicate balance that we also discuss is how much preparation is too much versus
Mhm.
how well are we preparing for the upcoming? Because, there can be such a thing as feeding into that kind of anxious thought cycle and patterns because we're almost over preparing or maybe preparing too much in advance. Or can you speak a little bit to that kind of balancing act that I know that we get asked by parents a lot?
I think it's looking at the child's developmental level and what they understand. So obviously the 2-year-old's understanding of, you know, nanny's gonna go bye-bye and you're not gonna see her again is gonna not make any sense. There isn't really a great understanding of time. But I do think having some explanation about, she's gonna be leaving, maybe going back to her family, someone new's gonna be there, I think is just good to kind of start that discussion, making sure he has some predictability in his life in terms of routines and different things. I don't think it needs to be something that's, you know, really repeated constantly throughout the day. But I do think there does need to be a little bit of understanding, and explanation so it doesn't feel like this person has been ripped out of their life. I always like the idea of creating kind of social stories or,
Yeah.
really having that reminder of, you know, they're going to go off and do something, could go back to see their own kids or their family, and what things will still remain permanent. I I also think the other flip side of that is not to ignore that altogether and not
Yeah.
have any preparation, because I think too much preparation over their heads isn't positive. I think no preparation is also not a great situation either. So I think
Yeah.
it's somewhere in the middle, wherever your kid is at. The older one is very verbal. He's almost 5. So his ability to kind of grasp and be able to say goodbye and maybe draw a picture or to say kind words will really help with some of that closure. Whereas the 2-year-old probably isn't able to do that yet. But, helping to just him to feel comfortable as possible and just making sure he knows he has caregivers who are there to stay.
Yeah. And I think that also it's like you talked about that overlapping period as well for maybe those two caregivers to have that overlapping period. So the new one is up to date with the routines and kind of so there's not too much disruption in the everyday life. Obviously there is disruption because one's leaving, but in terms of the routines and the expectations around what happens in the day and how the day is managed, not too much changes. So you have
I th-
that kind of
yeah.
continuity somewhere, I guess.
I think it also anticipate there might be some rejection of anyone new who comes in for a while, just because they're different and it's not the same. It isn't, their nanny or, who was there from the beginning. It's someone new and they're unfamiliar, especially for an anxious kid. Like that can be a very hard thing just to accept. Whereas other kids are like, great, someone new to play with. Those typically aren't the kids that we see. So I just think I try to always be really mindful of, looking at things before they happen. So kind of antecedent kind of thinking, um, within reason. Obviously, you can't prepare for everything. Things do happen without planning. But when it comes to big changes like this, I think it's good for families to be prepared. There might be behavior that emerges
Mhm.
afterwards while they're adapting. And it isn't because they're trying to be difficult. It's because they're trying to process, they're trying to understand, and they might be feeling sad. And that may come out as tantrums and irritability. It might come out as increased tears more often it might come out with some regression if this, sometimes with being able to feed themselves or being able to soothe, or if they're toileting, possibly some toileting regression. All of these things may happen, and just something good to keep in mind that we need to be sensitive that they're trying to understand change and it's hard for everyone.
Yeah, and that knowledge for parents is so powerful as well because then it can contextualize those difficulties that they're having and kind of
Mhm.
let you be more empathetic and understanding with those things when and if they come up.
Mhm. It's very true. All right, so that's kind of the big one for kind of preparing for change. Why don't we talk about a celebration that's already happened this week? I think you had one. And then I got to actually see him later today, which is really fun. So why don't you talk about your wonderful celebration?
Well, this was a very unexpected one. It's a little boy that we've been seeing in clinic for quite a while, and he has made leaps and bounds in progress, which has just been such a joyous thing to see. And I have been seeing him in school for maybe the past year and a bit, and he just got to the teaching assistant at his previous school. So he's talking to his teaching assistant reliably in his previous school and changed school. And so that was like, as speaking to the change that we've just gone through,
Uh,
was, a whole new environment. And it required us to kind of start back at the beginning again, really, because new people, new environment, totally different setup. And we kind of had to work really hard for those comfort levels to come back. And all of last year, I think it was in the last month of school, we finally cracked the teaching assistant again. And I was so happy, but it was the last month of school. And then we have a big break and we come back and it's a new teacher and different classmates. And so again, you're kind of contending with this whole new environment. And even though we kind of done warm up sessions with the teacher, we were lucky enough for the school to tell us who the teacher was at the end of last year. So we were able to have warm up sessions, but it's still a big deal. The teacher is the hardest person often because it's the person that has the most authority in the room. And it's the person that is critiquing them on their performance and marking them. And that can feel like a lot. And so having garnered the knowledge I have for the last 2 years, I was like, right, we're going in for the teaching assistant and we're going in early. Um, and I go with all of my stickers. It's loaded up with Minecraft stickers because that's what he wants, and a bunch of different candies. And I joined him on the floor for a class discussion at the beginning of the week, and he has never raised his hand in a classroom discussion. And they were having this discussion, and we were talking about the answers between ourselves at the back of the class. He's perfectly happy to talk to all of his peers in the class. Just the teachers are a big no-no. And we sat at his desk and we were kind of listening to the teacher talk. And he asked the class a general question. And all of a sudden, this young boy's hand goes, and I was like, what? And I kind of eyed the teacher. We both looked at each other like, and he didn't direct. And I actually think this is very astute what he did and is very emotionally intelligent because he kind of looked at me to be like, should I call on him? And I was kind of looking, give it a go. And he actually was
yeah.
very astute because he just looked at this young boy and kind of directed his gaze and kind of gave him the space without directly saying his name. So the whole class would kind of turn around and
Like,
be like, is he going to talk? Um, and he just turned around and the teacher asked him something about the respiratory system. And he turned around and goes, lungs. And we looked at each other. We were like, and so I think the moral of the story is they just can really surprise you when you're really not expecting it at all. And I gave him a whole packet of Minecraft stickers. I told him, what do you want? That was amazing. And I texted his parents afterwards just to let them know what had happened. And they asked him when he got home, Daisy's told us that this happened at school and why did you suddenly just decide to do this? And he just goes, oh, Daisy told me to. I was like, is it that easy?
Okay, you're in his head. You're in his head. So my
Yeah.
question is, did the teacher give him a labeled praise right after?
The teacher did. The teacher was like, Brian, thank you so much for answering that question for me. And then just moved on. And
That's
that
it.
was the best thing he could have done because he just moved on, didn't make it a big deal. Nobody else kind of realized actually that it had happened. And apart from me, who was there being like, oh, and it was just so wonderful. And I think his parents as well said, because they were so pleased and obviously had given him so much label praise when he got home. And that I got a text message just saying he's really proud of himself for being able to do that. And you just feel so privileged to be a part of these milestones in these kids' lives, especially when you've known them for such a long time and you've seen them progress so much. And for somebody else, it might have looked like such a small thing, but for us, it was like such a great, huge milestone. And then, of course, the following week is going to be half term and we're taking a break from school. And we just got some momentum. I'm like, um, and this term I would say has been really hard to get momentum because we've had typhoons and then we've had trips and the momentum piece is so important when you're working in the classroom and you're only able to kind of go in once a week. So
But I
I'm
think
really
that,
hoping.
yeah, that just goes back to change,
Yeah,
unexpected change, right? Like it's really hard to get traction, even when we have access into schools, when there's unexpected things that come up. And, it's our hope that this next term for you or this next part of this term after this break, we'll have a good stretch of weeks with, very few holidays to actually make some gains. And, some kids, really progress faster and some it's the marathon. It's
yeah.
it's the journey of it. And, you know what you're doing in terms of the skills that you use. We know how responsive he is outside of school.
Hmm.
We've seen it. We've worked on it. We wait till he's primed and ready before we hit the school.
Yeah,
And even then, it's still so hard.
yeah,
And it's a huge celebration, all these things. And, just thinking about, what happens when there is a big break like that. So how are you preparing for that break with his family so that when we come back, it isn't back to being quieter
yeah.
again?
And I think it's also like the expectation as well is like that conversation even happened with that kid. It's like, you did such a fantastic job speaking to the teacher today. You should be so proud of yourself. I'm so proud of you. The expectation is now that we answer the questions from the teacher because I know you can do it and I'm right here with you. And you want more Minecraft stickers? I've got them all for you.
Whatever you want.
Exactly, exactly. So fingers crossed that the half-term break isn't too just feels like a long time. I know it's just a week, but it just feels like a long time.
I mean, it's 10 days if you think about it. Like it's 2 weekends, 10 days. But as much as we can emphasize to the family to practice,
Yeah,
what's he going to do during the break? Are they traveling? Is he going to be at a camp? How can we still build in that brave talking
yeah,
practice even during those breaks? In fact, into new situations, new kids. We want to continue to build that confidence consistently in a way that, he's feeling it more intrinsically
yeah,
and is more motivated to overcome it. And raising his hand spontaneously for a group question, it's a big step.
yeah.
And we know he's capable. He's a bright kid, but that added kind of bravery of like putting yourself out there, it's huge. And I'm so glad the teacher noticed right away. There's just so
Yeah.
many things to celebrate here.
Yeah. It's just like that acknowledgement of that risk taking as well. Like even speaking to that change piece for him, like that's a huge change. It's a huge risk that he took, and he didn't need to take it at that moment. And I'm not sure exactly what motivated him at that specific moment to be like, this is my moment. But I'm so
He knew
glad
the answer, Daisy. That's why he knew the answer. It's like a layup.
yeah.
Respiratory system. I'm in. I got it. And who knows why? Again, we don't know everything that these
Yeah.
kids know, but it was the opportunity. And in one moment, everything just came together and testament to your dedication. and his support and how you were in his head even when you weren't.
Yes. And yeah, I think that's also like a message to any parent that's kind of watching now who's thinking, this feels really hard for my kid and I don't know if they'll ever get there. You know, this has been like a year and a bit in the making. This is not a quick thing that has happened. But he's got there and it's amazing to see. And so for anyone watching who feels like giving up or they
Yeah.
can't see that their kid might be able to get there, just know that there is hope and they can get there and it just takes time, but that's okay.
Yes, the goal is just to get them there, however long it takes, but also just also conveying that you know they will. I
Yeah.
think that's such a big piece is that we have that belief in them. And I think that's what we really try to convey to the kids when we're establishing that rapport and that trusting relationship is we're here with you. We're here to help you reach that goal. We believe in you and we're going to, help you learn the tools and strategies and practice so that you can do it. And I think that's huge. And we try to make it fun. And,
Yeah.
celebrating that win is huge. And just the pride he must have felt. It's huge.
Just a lovely reminder of to why we do what we do.
We're pretty lucky.
Okay, on that happy note, it's been wonderful to spend this time with you again, and we'll see you next time.
See you next time on Brave Talk. Bye.
Bye.